Well, my name is Hans-Peter Brunner-La Rocca, and I'm affiliated with the Maastricht University and also the Maastricht University Medical Center. And I'm the coordinator of an IHI project related to precision medicine in cardiovascular disease. Well, I think it is really important to have this kind of collaboration, not just not just within my own medical field, but also with the different stakeholders. Because often in clinical practice, but also in research, we're really focused just on our own vision, but really to bring innovation forward, it's important to have the patients involved, other stakeholders, also regulatory agencies, the tech partners, pharma partners. So I think that's very important. I think here this is a conference where really brings these people together. I think that's an important part. On the other hand, I also see how much difficulties there are in bringing innovation forward. We have a lot of administrative hurdles. We have a lot of regulations. And I really hope that, particularly regulators and administrative persons start to understand that they actually should reduce just the burden and really listen much more to those, the patients, the physicians that really are dealing with healthcare innovations to really bring that forward and more to facilitate that instead of hindering it. Well, I think, of course, we have a lot of innovative people in Europe, and it's not just in one country. And I think also regarding culture, each country actually can contribute by the own view they bring in. Of course, in many countries, innovation is not really equally distributed. So countries can actually learn from each other. And in innovative projects, it's important to really bring the stakeholders together. Then we can achieve much more, as I highlighted before. And doing that in an international context really creates much more momentum and is also, in the end, easier to implement it than just focusing on regional initiatives. On the other hand, I think it's also important, and for that, we also need the different stakeholders that we then also can bring innovation from a European level back to national and regional levels, that we have this interaction. But also there, we need the people from different countries that actually can contribute to that. Well, if I look at what I'm busy with specifically, so I'm a cardiologist by training, and I'm, as I said, the coordinator of a large IHI project where we deal with precision medicine. And I think this is really a key key message I would like really to make, that we should more focus on the patient's individual needs instead of just looking at effects that are more on a population level. I think that's one key message. And the other one, and I think this is really important, we really face the problem of limited resources in healthcare. And that's also something we are not talking too much about it. We're facing the problem of an increasing amount of elderly patients with chronic diseases due to the aging population. But on the other hand, we have limited resources financially, but we actually have also a limitation in the availability of healthcare professionals. In fact, they're actually decreasing, and we need to find actually a solution for this imbalance. There are already regions in Europe where you have to wait, for instance, to see a specialist for 6 months or even more. You cannot really expect that you can deliver this way adequate treatment. So we really need to think about how we can actually solve the problem in that regard. Personally, I think the patients need to be much more in charge, and they need to be facilitated. And with all the digital innovation, that actually should be possible, but we need to adapt this paradigm shift. And we also, again, with the regulators, but also with other stakeholders, we need to bring this forward, that this is being accepted.